First of all, I want to thank Lynn and Monica in particular for pulling together this conference. This is one of the best conferences I think I have ever attended.
I'm about 4.5 months pregnant and I'm in severe pain. I've been doing research on the internet and I came across MCHAccess.org.
I hope we will hear pregnant women today and help identify barriers and solutions and work on policy at the state and local levels.
And we know that pregnant women don't usually go to the dentist. You know, PRAMS, which was something that was done across the country, said at most 56% of women went to the dentist one time, and most likely it was for an emergency visit. So only 1 in 2 went during their pregnancy window nationally, and it was only for an emergency visit. Women delayed dental treatment for their cavities until the first 60 to 90 days after they had their baby. So they suffered in pain instead of seeing the dentist, or the dentist told them to wait until after they were pregnant. Dentists, OBs, midwives, social workers, case managers still don't sort of embrace this idea that dentistry at any stage of pregnancy is safe. Any stage. Women who have high amounts of dental decay causing bacteria can transmit it to their baby as early as 3 months. And really, this delay of colonization means if I don't actually transmit my bacteria to my baby until they're 3 or 4, they have a much higher likelihood, up to 20 times greater likelihood of never having any type of decay in their childhood. California is one of the few states that in their Medicaid program offers an expanded benefit package for pregnant women. Only 20% of pregnant women, access their services. So there are a lot of things that we need to do to continue to help spread the message both to the provider community and to the patient community.
My concerns is regarding the medical consent. We know that pregnant is a healthy women, but still we have a lot of hesitation to work on them if we don't have that medical release. So what is your advice?
As dentists, we don't work under physicians. We're not a nurse practitioner or a physician's assistant. We have our own medical license to practice in the state of California. There is no such thing as obtaining medical authorization from the physician. It doesn't stand up in court. Basically, the physician can give you information. They can offer an opinion. You need to educate yourself more on kind of the perinatal process and be comfortable in making those decisions because medical consent does not exist.
A lot of folks do have untreated dental problems that now when they are pregnant, they're coming into care maybe for the first time since their last pregnancy, maybe for the first time ever. And that is a reason to send folks. But we do not routinely send folks just for cleaning, and part of that is because they get turned away.
But I think if a physician, my OB-GYN say, I need to go see a dentist, that has so much more power than any brochure or pamphlet or anybody else. But if this sentence comes from his mouth.
So that's it.
One sentence.
Ask, your medical assistant or your dental assistant, go through some of the trainings that are available on oral health, and just ask them to ask one question to a pregnant woman as they're seating them. And, say that day she needs to ask 3 pregnant women that she's seating into the medical exam room before they see the OB about their teeth, or have you seen a dentist while you've been pregnant? And then just have them report back to you. And then start to grow it. You need to find champions within your programs, and you need to find people who you've seen the light bulb go off and that you can work with to try and engage others in this conversation.
Your sister, your mother, that they are entitled to the pregnancy-related services that Medi-Cal does offer. They mentioned giving pregnant women priority, maybe by accommodating the time that you see pregnant women. What if 10 a.m. is the best for your patients? What if it's a different time frame? So always trying to accommodate and give priority to pregnant women.
An online directory of Medi-Cal providers doing dental service who are willing to accept pregnant women. We acknowledge that, keeping that updated could be a challenge, but there were some great suggestions about working with the federal government, which is doing something similar in pediatrics.
As part of CPSP, referral to dental care is one of the 5 mandated referrals. And that is something that I think needs to be publicized far more in the OB community, which is that we're already mandated to make sure, in the same way that we're mandated to make sure that folks know about WIC and they know about the genetic screening, which is offered by the state of California. Patients are entitled to decline the genetic screening, but we have to tell them about it. Patients would be entitled to decline going to the dentist during pregnancy, but we have to tell them about it.
We need the root canals. We need the dentures. We need the whole range of the standard of care. We need to make that available to the women. They have a need for it. Our messaging about bringing providers and consumers into this system will always be hobbled if we have to say, well, they get this, but they don't get that, and sometimes these people get that and those people get that. It's a very difficult chore to do our social media, our Hollywood media, our dental parody, our P25, to really bring everybody in the system together if we don't have the full range of dental benefits. And so it's an exciting time in Sacramento now. We all really need to be carrying that message. Thanks, and good luck with this terrific work that you're all engaged in.